me start this. Yep. So hi guys, hope you're doing well and keeping warm. This is Baridi, I don't know where it has come from, but we will survive. Luta continua. So today I've got my guest is Wangeci Karega, also a friend from way back. And as usual, I'll let her introduce herself first before I go on to why we have her as a guest today. Hi Wangeci.
Hi, how are you?
Good, and you?
I'm super.
You must show more that Queen's wave to them.
Niko salama kabisa.
Salama kwa salama.
Niko salama kabisa. Golden. Yes.
You're not feeling the baridi clearly?
Not anymore. It's funny. Since I started treatment, I don't feel cold. It's a strange.
Okay, yeah. Excellent. So Wangeci here is a cancer soldier. Is it a cancer fighter, as we popularly like to call them? We will talk a bit about what she's been through, how it came about, and basically how it's affected her life, and how other people, with similar, conditions, can actually get through this. Because I had a cousin who had the same condition, but hers was actually skin cancer, but I forget the actual name. But she was really young, had Jazra. The dude had Jazra shared for her, and then, this thing blew up. And unfortunately, we lost. But today's not about my cousin; it's about Wangeci and how things are going. So, how's the journey been so far?
It's a rough classroom. Rough. It's a laugh. You laugh sometimes,
yeah.
But it's rough. It's rough. It's a rough one. I can tell you that. Yeah.
Okay. And just for the record, she's actually in her young past 20s. Yeah. So just for clarifications. Unless you can feel free to tell people if you want to.
I'm a proud 39-year-old.
Oh,
proud.
Sorry. So, ladies and gentlemen, there you have it. A woman unashamed of her age. Please follow suit.
Completely. Yeah. Completely. It's mine.
It's yours. You have to own it.
I own it. Yes.
And you're a mother as well.
I'm a mother of one son. 6-year-old boy.
Sorry, 6.
6-year-old. Yeah.
Excellent. And how is that so far, being a mom?
Wow, it's amazing.
Yeah.
It might be harder than cancer, to be honest. that might be harder. That might be harder than cancer for sure.
Being a mom.
I mean, but that's another story for another day. Yeah.
Okay, cool.
But I'm in the. I think now in this place I am right now, I appreciate him more than I did before.
Okay.
Like I just want to hold him and to kiss him and to hug him and to be near him and to smell him and to. I mean, it's yeah,
Boys get to that age where like, yeah, you're no longer cool enough. Now you want to kiss me, hold me, like I just
yeah.
Get off.
But he's so sweet. I'll tell him, come, I want to hug you, and then he'll come and then he'll say, have you had enough? And I'll say, I've had enough. And then I'll say, yes.
Have you had enough?
Yeah, Mommy, have you had enough? I say, I've had enough. Now you can go.
Okay. There's a smooth operator. It's gonna be a player.
Yeah.
So what's
He's very sweet.
What's his name?
His name is Louis.
Louis. Yeah.
Louis.
So Louis, ladies, be on the lookout for Louis 20 years from now. A lot of heartbreaks.
Yeah.
So tell us, so when did you get diagnosed? When did you find out, about your cancer? And what kind of cancer?
Well, I was diagnosed in January of this year, but I discovered my lump on the 26th of December.
Oh, okay.
2019, last year, 26th December, Boxing Day.
Right after.
The day after Christmas, I was in Nairobi alone. My entire family, my parents, my child, my brothers, and my siblings and their children had all gone to the village, but I had to work. So I was alone, going between my house and my parents' house to make sure both houses were fine. And I was in the shower in the morning, and I found a lump in my armpit. Actually, what I found was a lump in the armpit.
Okay.
when I was taking a shower. And I thought that was really cute because it wasn't painful, but it was moving around. And I was very curious, what is that?
Yeah. Yeah.
So I got dressed and I went straight to the hospital. And I walked into the casualty, and they're like, "How can we help you?" And I just kind of like, I don't know what that is. I don't know what that is. So but they were really good. They did an ultrasound. They did a breast ultrasound. In their wisdom, they did a breast ultrasound, and they did a mammogram, and they did a blood test, and all of them were clear. So I was sent home and told, well, you're fine. You probably have an infection. So give it a while. Those are the lymph nodes. Your lymph nodes are swollen. It's an infection. It will pass. And on my report, it says on my imaging reports, it says repeat after 1 year.
For 1 year.
But after 1 year, and I came home and I just like, no, why are we repeating after 1 year? Like, okay, fine, I may have an infection. I've had infections before, but I've never really swelled in the armpits.
Yeah.
So
Yeah.
I couldn't shake it, and I didn't like it, and I just wasn't satisfied with that. I didn't tell anybody. I didn't tell my parents until they came back. Like after New Year's, they got back, and I was like, "Oh, Mom, by the way, I have a lump," and I did a mammogram, and I could just see her just, I mean. And she was like, "No, we're not waiting." And I said, "That's what I thought." So then I found a doctor and another doctor and a third doctor. And all of them said, then we need to remove that lump and test it. Because if it's not showing up in the mammogram and it's not in the ultrasound, let's biopsy it.
Oh, wow.
So in January, I went to theater. We went in to remove one lump. He found 6. The guy who removed them found 6.
What?
6 lumps. And all of them had cancer. Every one of them had cancer.
Oh, wow.
So, and in that report, it said, it's cancer, but it's a breast cancer. So it's like, now go find it in the breast because this is a breast cancer. So this was a secondary location. And so at that point is when, okay, fine. And for me, it was like, what do you mean I have breast? They have no lumps. And I'd been examined at that point by 4 different specialists. And all of them said, your breasts are fine. Like you have nothing. There was no change in the skin color. There was no discharge. I didn't have lumps, nothing. So eventually I saw a breast specialist and he ordered an MRI of the breast. And that MRI showed lesions. I've never had lumps, but I had lesions. And he said, well, that is breast cancer. You just don't have the lumps that most people present with. So that's how I discovered my cancer.
So, but okay, that's strange. Sorry, I'm not a scientist, I'm not a doctor, but lumps in the armpit, nothing in the breast.
Lumps in the armpit, nothing in the breast. To date, I've had no lumps in the breast. Yeah.
Oh wow! And how was that?
And apparently it happens. Some people are diagnosed with breast cancer and it doesn't show in the breasts. It shows in when they biopsy, say the lymph nodes, but it doesn't show. It really changed because we are taught to do the breast exam, like
For
that
yourself.
self-exam.
Yes.
For yourself. And I remember just thinking, whoa, like if my lymph nodes hadn't swelled, how long have I been walking around with breast cancer before it moved into my lymph nodes so that they could swell? Nobody knows how, and yet you think you're perfectly healthy. And so, yeah, it does happen like that.
Wow, and then all the 4 doctors you saw gave you the same diagnosis, like, yes, cancer.
No, the biopsy, the lab result was, this is cancer.
Oh, okay. So the 4 docs you saw were saying you're fine.
I'm seeing them to kind of like this lump, so they would touch it and say, well, yeah, we feel it. It's probably a lymph node, but unless we biopsy it, we don't know what that is.
Okay.
So eventually I was sent to a surgeon and we went to theater and he removed it, and so there. So yeah. Right. So that's how I discovered it.
And how was that news? How did you guys take that news?
Well, when I got the results for the biopsy, I was with my mom. And my mom, because I remember just feeling like, okay, they called me and okay, your results out. I'm like, oh, okay, okay. Somehow, for some reason, throughout the whole thing, I wasn't really processing this. I knew this can, I mean, by the time the people are talking about biopsy, you have a rough idea where this is going. I was like, oh. But because my dad has had his cancer for a while now, and had been watching this man, and I mean, the man, he just keeps going. He just keeps going. Like he doesn't allow it to define him or to change his plans or now I'm not doing this because and for him he just keeps moving. And I can say, okay, fine, well, that's one way. So in my mind, I'm like, well, that's one way to do cancer, you know. And then I had a friend who had breast cancer and who had passed away, I think the year before. And that was devastating. And I remember thinking, oh, okay. And this girl fought. And I was like, okay, that's another way. You fight until. So I had done all this. I didn't have a big emotional response to it because, again, at the point I didn't have a diagnosis. And when I got my diagnosis, I was with my mother. And we are reading it, we have this piece of paper and we are reading it together in the doctor's office. And she read it and she goes, hallelujah. And I look at my mom, I'm like, and she says, no. This one we can do. This is easy. This one is easy. This one is easy.
What?
And at that point, I was like, okay, this one is easy. So that was it. And I never had time to kind of despair and, oh my goodness, I have cancer. And she never gave me a chance.
Yeah.
She just kind of like, yes. Oh, and I remember afterwards asking her, and she says, cancers can be rough. Like there are bigger ones, harder ones, cancers that are difficult to treat. Wow. Breast cancer is treatable. People survive breast cancer every day. This one is the easy one, Wow. And so for me, I in my mind, it was just like, okay.
Hey, bless your mom. Right back down there. Yeah. Your mom is a superhero.
Yeah.
And hallelujah, let's do this.
When she read the response, her response was hallelujah. The last line. And I remember thinking, yeah, this one is easy. This one we can do. This one we can do. And she was done. Like, that's it.
Next.
Yeah, next. And so for me at that point and until now, that in my mind, I keep hearing that this one, it's we, because we in my family, all of us are doing this cancer. Yeah. We can do. So everybody, it's like that. I mean, I don't book my doctor's appointments. I don't look for my medicine. Other people in the family do those things, We are doing it together. And so she was, it's a group effort and that's how it's done. So.
Yeah, having a support system that powerful,
it's everything.
Good is everything.
It's everything. It's everything.
Pretty much everything in life, but especially like now, you need that sort of support actually to keep you going. And then,
yes.
So wow, so your mom, you actually thought your mom was going to be more shocked than you, but clearly she was like, hallelujah, yes.
No, she's my mom is strong. She's like, I don't know anybody as strong as my mom. She has, wow, she's the iron lady. She's strong. She's really strong.
Lovely.
She's not easily phased by things.
Yeah. Yeah, see where you get that gudi fighting spirit from, clearly.
Yeah. Well,
it's okay. It's a good thing. It's a positive.
Yes.
And then so after the biopsy diagnosis came out, mom said, hallelujah, let's fight this. What are the next steps now? You had to go for
next steps. You see the specialist and okay, so what's the treatment plan? And then you're told what is the treatment plan and then you move forward. At that time, I had had an experience at one of our local hospitals that was not too rosy. So, and I had a problem with that particular doctor.
Okay.
And so I was feeling very disgruntled with the way we had interacted. And so when we discussed it, we decided that I would go to India and do a PET scan. one of the reasons we really wanted to do that PET scan is because at that point, when I got my diagnosis and they had said, go find the breast cancer, we did the breast MRI lesions. And then then I was told to get a CT scan of the chest. I got that. Then when I took those results, I was told, now we need a CT scan of the abdomen. So I went, I did the CT scan of the abdomen. Then I was told, okay, now we need a bone scan. And I remember looking at this doctor and thinking, hey, at this point, my insurance is exhausted from all the testing and the surgery.
Yes.
And every time I saw him, it was, okay, now go test this. And I remember just looking and thinking, how am I ever going to do, like we're going to test piecemeal every part of my body like that. Yeah. Like we'll test here and then, and I remember getting really frustrated and I came home and I'm like, I'm done. Like my insurance is almost done. Yeah. I have a 6-year-old son in the house who is on my insurance.
Yes.
And we are testing this thing one area and I got really frustrated. And so I spoke with another doctor who said, you need a PET scan. You need one PET scan, like, and then we are done.
For people who are like me, please explain what PET scan. What is PET?
Okay, so well, I'm not sure what PET means, but the PET scan basically scans the entire body. It scans the body.
Okay.
So that now it will find it will scan the body and it will find the cancer wherever it is.
Okay. Okay.
So as opposed to doing, let's do the chest and then let's do the abdomen and then let's do the pelvis and then it's the one scan so I went to India. I did the PET scan. I don't have cancer anywhere else in the body except the lymph nodes. It had only moved into the lymph nodes. And so at that point, they told me I'm a stage 3 because it has moved. Oh. So at that point, I was really excited. Ooh, this is easy. And they're like, it's a secondary location. So you're stage 3.
Yeah.
Yes. And I remember feeling, that shocked me. I'm like, I was kind of feeling like, I wanted to be a stage 1. Yeah. And they're like, no, but you're fine. I mean, like, apparently the distance it has moved is important. You're telling me that's a very short distance between your breast and your armpit. So I was like, oh, okay. So me relax, you're fine, you know. So we did the PET scan and then I started treatment. I started on chemo because again, it was spreading. By the time I got to India, other lymph nodes had swollen already. That was like within 3 weeks. They found new lumps. Yeah, within the 3 weeks, I had about 4 new swellings.
Yeah.
And so they were telling me, no. So we need to start with chemo. So my treatment plan is chemotherapy, surgery, radiation. That's my treatment plan.
Okay.
But it's different for many people. I've met other women doing treatment and they started with surgery.
Yeah.
I mean, if you have just a lump in the breast, and then okay, we'll start with the operation and then chemotherapy and then radiation. Okay. It's different for everybody.
Okay.
So that's where I am.
Okay, so you've done your chemo.
And I finished my chemotherapy.
Okay. And how was that?
So I'm waiting for the chemotherapy. allow me to laugh. Chemotherapy is I would describe it like a demon you visit every 2 weeks. Honestly, for me, it's like he lives in a house and we go visit him every 2 weeks.
Uh-huh.
And he does his foolish things and then we go home. Like it's so, I mean, and I say this even without huge my body never reacted badly to chemotherapy. Oh. I've never thrown up. Oh. I've never thrown up on chemotherapy. Mine was on 2 drugs. I started with 1 drug that gave me nasty nausea, just debilitating nausea. I never threw up, but it's the kind of nausea that even like the people could not eat in the same room. Like you can't
smell.
Go. Yeah. I just no. I could smell the neighbor's food. I could smell the street. I would tell my sister, I can smell the street.
The street.
And we were like, the street. I can smell the street. Like just nosy. A perfume, an air freshener, food. So it was just nauseating. Yeah. I could smell the drains. I already have a very strong sense of smell, but I could smell the drainage. Like every evening when we went to sleep, I would cover the drain of the shower with a bucket. I would put something on the sink at the drain to cover it.
What?
Because I can from the bedroom, I can smell the drain of the sink. I mean, it was bad. So I had that drug. The biggest thing was nausea, and of course, you feel really tired and brain fog. On that drug, I didn't have two cents to knock together. Like I couldn't construct. I mean, you're just foolish. You're foolish. Like, huh? What did you say? Just a very bad brain fog.
Yeah.
And then the second drug, no nausea, but pain, like physical pain. Like for 4, 5, 6 days after that chemo, it's just painful in the muscles, in the bones, in the joints, just pain. But I don't know. There's a place in your brain that also tells you I suffer this because it is medicine. You know that you feel this way, but it's killing those cancerous cells. So you suffer it, but there's a voice at the back of your head that tells you it's not forever.
Just jikaze, it's going to be okay. This is means to an end.
Yeah, exactly. It's a means to an end. Of course, there are foolish things like, I mean, my hair fell off.
Yeah.
My eyebrow, now I barely have eyelashes, which is strange. My nails turned black. You can see my nails are black.
Mm-hmm.
At least they did, but then I say I appreciate they didn't fall off. There are patients whose nails fall off.
Oh,
so even when you say this is hard, you always know just calm yourself down. There, it could be worse.
Yeah.
Yeah. So it's hard, but it's.
Most people watch movies, yeah, and we see the hair loss thing and everything else, and we know how chicks are about their hair. And how was that for you when the hair just,
Okay, so I don't care about hair.
Okay.
I honestly, hair is not a thing for me.
Okay.
But there's something about your hair sliding off your head. and that's exactly what happened. So when I came back from India after 2 chemos, then I came back home.
Yeah.
I said, no, I want to go and finish my treatment at home. Because I mean, I was doing chemo for 3 months, so I wasn't going to stay in India for 3 months. So I came home to finish my chemotherapy. And when my hair was braided. And I remember in India telling my sister, can we take out these things so that the hair can fall? And she said, nope, we're not touching that thing. Let the braids hold it there until we go home. So that's what we did. I came home, I took off the braids, half my hair fell off with the braids. And then I was like, hey, you know what? All those games I wanted to play with the kinyozi, let me go. So I went to the kinyozi. I told him, knock yourself out.
Yeah.
Nywele, katalaini, shapes, knock yourself out. Zigzags, coconuts. Yes. I mean, like, what's going to happen?
Yeah.
So he did. We cut lines in the hair. I mean, I had a nice fade. And I came home. And since now you have come from the kinyozi, you need to shower.
Yeah.
I walked into the shower, and I remember it just slid off.
And you're laughing about this.
It just slid off. I remember thinking, what a waste of time. In my mind, it's like, what a colossal waste of time.
I hope you took a photo of your fade.
I didn't have to. I would have taken it when it was clean. It slid off my head. Fresh. It slid off my head. No. I have video.
Okay.
But so, I remember just trying to remove it. Like, okay, kind of trying to pull the hair. Come on, sour bath. But honestly, for me, that was hilarious. It was more fun than devastating to lose my hair. It was just. I had hoped to have a fade for like three days, but it didn't last 3 hours.
Looking at the bright side of it, you're like, it's okay.
Sour. It's never that serious, by the way. So that's how I lost my hair.
Okay. And God bless. At least you have a nice kichwa, for.
Do I?
Yeah. Yeah, you know, there's people who get. If you remember Tony Braxton days, and every chick wanted to be like Tony Braxton with a wet look, and some of the kyongos out there, oh
But they're ours. They're ours. Those are the
Lord,
ones God has given us. So I've learned since then that my head is like my brother's. We also took pictures the other day. We stood next to each other and took pictures.
yeah.
We are trying to have fun with it. I feel like we just need to find the silver lining. Just
True,
have fun with it.
true, true,
Yeah.
true. I mean,
Yeah.
it takes a strong person to actually look at the brighter side of certain things. Yeah,
No,
that's
it's
something
fun.
you
No,
got.
it's
Excuse
fun.
me, you got your mom's strength out of that side by there for sure, and knowing your
No, they're
brothers
fun things.
must
No,
be
have
having a
fun.
lot of fun at that story. But
Honestly, my oldest brother, my oldest brother,
yeah,
Mr. Mutahi, calls me one day and says, "Hey, I hear you look like a bulb."
do you look like a bulb? I can surely.
I was like, "Really?" He's like, "Yeah." So I've just talked to I don't know who, and they tell me you look like a bulb. I was like, "Yes, brother, I look like a bulb." I mean,
Uh, yeah, yeah.
everybody is having a very good. My son is having a very good time. He rubs my head like he comes and he rubs on me.
The
Like,
one I remember
if
when you posted, you're having fun with your eyebrows, and you had posted one like you're doing like so, and I was like,
Yes, and my son now,
well,
if he's bored, he asks me, "Mommy, can I draw your eyebrows?" I tell him, "Sure, go ahead," and I give him and he draws them. So I mean, it's
how long after the hair
so
fell off did the eyebrows fall off?
no, the eyebrows took a while because
Okay.
I've historically I've strong eyebrows. Mine are
Yeah.
strong.
Okay.
So it took a while. It took a
Okay.
while, but and then okay, I think for me one of the most frustrating things about it, it's not if it's all of them, then we can replace them.
Yeah.
But when you lose half, it's like, what do you do? Like, what am I supposed to do with half an eyebrow? You know.
Wow.
So sometimes it's like ah. But then again, I feel like if we all of us try to have fun with it, and
Yeah.
then it's
Basically.
not so. Especially for my son, I wanted it not to be serious. I wanted
Okay.
him to know that it's like it's mommy is sick, but we can still have fun. You know.
Yeah. 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 I
Yeah.
mean, it makes sense. I mean, that makes a journey more bearable as well, because I
Yes.
mean,
Yeah.
sometimes they say sometimes it's not even the disease that kills or that makes people actually go into depression because you have no
Yes.
support system around you.
Mm-hmm.
People actually give up hope because you're feeling okay, this is it, it's a wrap and I'm done, and people around you are making it positive, and you yourself
Yeah.
as you're not letting your spirit go down, and of course your
Yeah.
son being there, that also gives you a big
Yeah.
plus for that as well. So it's really good. No, you keep on keeping on, man. That's really, really dope. And so what's next? I mean, now you're done with the chemo, so then now you go into the
So
surgery.
now in a few weeks I'll do surgery.
Mhm.
After surgery, a few weeks, and then radiation. I was warned by the doctor. This will cost you between 6 and 8 months of your life. So just relax.
Okay, okay, okay,
Just be easy.
okay,
So
okay. And then after that, at least, then now the recovery begins, I guess.
and then the recovery, and it is a recovery because like now I need to purge all those drugs from my system. So I drink a lot
Yeah,
of water.
yeah,
I
yeah.
try to eat healthy, fresh air.
Mhm.
So yeah, you
Okay.
do the best you can.
I know. I mean, but I mean, it's so. What would you tell people who have that, that gut feeling? My end, I can tell you, my cousin initially was diagnosed as eczema. So we all thought, like everything was eczema, but it kept on going on. And she used to have dreads, beautiful dreadlocks, and then you notice, no, this eczema, Kwani, it's what's happening with it. So I think had that diagnosis been caught earlier on, it would have probably made a difference, because trying to
Oh yeah, for
on the back
sure,
foot. Yeah. So what
for
I mean,
sure.
what do you tell guys who are actually going through similar things? Whether
I
you're
think
suspicious or you actually have it, or you're going through chemo, whatever part of treatment it
I
is.
think I think we need to pay attention to our bodies, like generally. Even the only reason I knew I didn't like it is because I knew what my body is like healthy, you know.
Yeah, yeah,
And now when I think back, this last half of last year I was tired all the time. I was struggling to wake up in the morning. And I loved my job. I had a wonderful job back then. But I remember asking myself, why are you struggling to go to this job? You love it, like you're happy there.
Yeah.
And I couldn't figure out why. I had seen doctors and they're like, well, I've done blood tests. There's nothing wrong. Because I'm like, test me, something is wrong. And like, nothing wrong with you. So when I found this lump, it was like, okay. The one thing I will say is I would never have found that lump when I found it if for some reason that morning I used my hands, like my fingers, my bare fingers on my body. And I realized many of us don't use a washcloth or you use a loofah or whatever you use.
Whatever it is, yeah.
And so I've told all my friends, when you're in the shower, after you use your washcloth or whatever, run your fingers over your body, because then there are things we are missing because we are using, there's a barrier between you and your body. So I do now, I actually use my fingers on my body to just feel for anything strange. But also that gut feeling, when I was told repeat after 1 year, I remember just thinking, no, I mean, what, like, no, especially because they hadn't told me what it was.
Yeah.
So you're saying it's not cancer. We've done a mammogram and an ultrasound on the breast. I'm like, okay, what is it? I had done a blood test. So you've told me it's an infection, but this infection is not in the blood. Oh, well, it can take a while. Your body is fighting. I'm like, what is that lump? So I think just you follow your instinct, and then do the annuals, especially as we get older. I mean, we are at the age now where your body, we are not 22 anymore. So do those exams, do the checkup, do the blood work, and then ask questions. I feel like if me and my mom had not been aggressive with you see this doctor and then you see another doctor and then like, no, until someone gives you the answer, just keep pushing.
Yeah.
I met a lady, I've met two ladies who were both going through treatment. One of them found her breast cancer during a company annual physical exam, the one done by the company. Yes, so it's like, go, stop. It's not a punishment. Just go do it.
Yes, it's on your.
Go do it.
Yeah.
Yes, so that's how she found her breast cancer. The other lady had a pimple on her chest, a pimple, and and she took it to a doctor and said it's just a pimple. And she said, 50. I've never had a pimple on my chest. Why now? Why do I have a pimple on my chest? And it was cancer. She has breast cancer, has showed as a pimple on the chest. Wow. My aunt had a funny thing on her skin all the way behind here, and it was breast cancer. So we imagine breast cancer to be something tucked nicely inside your breast. You will find a big lump, and you'll find it during when you do the exam. And I honestly wish it was as simple as that. But we also need to pay attention to the other things that are happening in our bodies, and to just pay attention.
Yeah.
I don't know why I have breast cancer. I mean, there are all manner of theories. Stress, maybe. There's so many theories out there, but for me, honestly, it doesn't matter. All that's important now is that, okay, you have it, get it treated, and do it with all the joy. And for me, it's all about gratitude and just appreciating that. Thank God I found it. Thank God I found it when I found it. Thank God I'm surrounded by people with a fantastic attitude. I thank God every day for the grace to be happy and just, because I don't think the people who are not are like that by design. Somehow, for some reason, God has just shielded me in happiness and joy and gratitude. I wasn't always like that. I've told you, if I had gotten this diagnosis 4 or 5 years ago, I probably wouldn't be as joyful as I am these days, because I wasn't in a good place in my life back then. Okay. So if I could tell anybody who will watch this, is that I think we should strive to be our best selves, to be as happy and content as much as possible, so that when big bad things happen, they don't knock us down. You know, so because if you're in the pits and then something like this happens, then it's, you know,
Crush you.
you it will crush you. So
Yeah.
I say just learn joy and gratitude, and just be selfishly protective of your sanity and your joy, and like just, yes, so that when things happen, they just don't crash you, you know. the, yeah, everything else I feel like we can replace, like especially at a time like this, the things we've lost, the jobs we've lost. I lost my job because of COVID, and even that was not, I remember receiving the text message from my boss, please come into the office. And I told my mom, I know what conversation this man wants to have with me. And she's like, hey. And I go, yeah, I think I get it. And she's like, and how do you feel about that? I'm like, I've gone to tell him thank you for the job in the first place, you know?
Wow.
Yeah, because and I remember just telling him, yeah, I thank you so much for giving me the job in the first place, you know, and thank you for allowing me to be here, and thank you for paying me when I got sick, and thank you. And I get it, this thing is happening. You don't need to explain it to me. I couldn't have had that conversation back then, but now I'm just feeling like, big things are happening, bigger things are happening in my life. I'm not gonna mourn that, you know. So just and just count your blessings. Even when things are in the pits, there's always something to be thankful for. Always. Like I every day I find things to be thankful. When the sun shines, I'm like, wow, that's a beautiful day. I thank God for my family. I thank God for my son. Even the people who used to annoy me and who, and when I pray, I bless them. And I, you know, God bless Ngania and give him wisdom. You know, because he needs it. He needs it to give him wisdom, but bless him.
Stop
you
being
know,
annoying.
you know, I mean, honestly, very few things right now can faze me. Like I keep telling people, like my capacity for nonsense, like I don't know what you can do to annoy me now. I'm like, not today, not right now.
Not today, Satan.
like it just things don't bother me as much as, I don't know if it's you get perspective, or you're just reminded of how fickle life is in the first place. So I just live your life. I mean, and just strive, because I think happiness is a choice. We choose. We actually choose. So we need to decide every day just to be, just because the problems are there, whether we are happy or sad about them.
True.
Whether we worry about them or not, the problems are there. I'm still unemployed. Even with my sunny disposition, I'm still unemployed. So what does moping and whining and, you know, how does that help my employment? It doesn't. It really doesn't. So I just yeah. So that's what I would say. Just strive for happiness every day, to be happy.
Wow.
And remove the negativity. And mostly it's people, those people who are not building. If you spend time with somebody and when you leave, you're tired and drained, stop. Just stop. I don't suffer those people anymore. I just don't. If I see you, hi, and then I keep going. I don't have time. Hi.
Moving along swiftly.
Moving along. Don't have time for the, no, you know. Because we do that. We are so, especially as women, we're so busy being polite, and we want people to like us, and we want people, you know. No. Just be polite, but keep it moving. Hi.
Politely moving.
Yeah, just move, you know. So yes, that's in many words. Yeah.
No, thank you very much for that. People, you heard it for yourselves. Gratitude, joy, are just but the two things you can do daily just to keep your spirits up, and just, you know, regardless of your situation. So you've heard it from Wangeci. She's still going. She's just finished her chemo, about going for radiation. we'll pray for you. We'll be with you, of course, in this journey. And God willing, everything else that's out there in the world that's not working out will also change and work for the better. But
Yeah.
we really thank you for your time, your feedback, your happy thoughts, and your words of encouragement. Because I mean, to be honest, it's not an easy thing, but we thank you and we appreciate you very much.
Karibu sana.
Yeah. And we'll do this
Karibu
again,
sana.
definitely. Once
Yeah.
you're done with the last phase.
Once I'm done with the last one, yes.
Yeah. All right, cool.
Yeah.
Thank you very much.
Okay.
Have a lovely evening.
All right. I'll have hair by then.
By the way, true. You'll be doing for us, you
I will.
So, all right.
Yeah.
Ciao.
All right. Bye.